We are in a healthcare crisis in the province of Manitoba.
Manitoba's official opposition slams the NDP government over their healthcare promises after one of the province's top trauma centres gets grey-listed by the nurses' union.
The jewel of Manitoba's healthcare system is now an unsafe workplace under this NDP government.
Last week, the Manitoba Nurses Union voted to discourage employees from taking jobs at the Health Sciences Centre. This all follows a string of sexual assaults in and around the hospital in early July. Khan also pointed to failures in home care and the mailing of essential checks, the latter of which the province paused, then restarted.
They said they had the answers. They said they had a plan. The NDP said they would fix health care. They spent an entire election on a promise saying they would fix health care, and nearly 2 years later, we are a healthcare crisis under this NDP.
In a statement, a spokesperson for Health Minister Uzoma Azagwara says no one trusts the PCs to run healthcare, and if Abi Khan doubts that, he should look at the last election results. Manitobans voted them out because they closed emergency rooms, cut healthcare staff, and left communities without the care they need. That's the damage our government is fixing, damage that takes years to repair, not the 2 years the PCs pretend is enough. But the head of the Manitoba Nurses Union says the blame game needs to stop.
A lot of this issue that happened, that's happening in healthcare, did start with the PC government. The NDP government did get into power with a mandate to fix healthcare, and healthcare was going to be number one. And we're almost 2 years into the mandate, and we've really seen no improvements.
Jackson is looking for concrete action, like making sure there are controlled entrances and a staff-wide alert system. Shared Health says they're working on procuring the latter and laid out a list of improvements they've done in the last several years.
The majority of those, in fact, I would say almost all of them, were done because they were compelled by an arbitrator.
In a statement, Shared Health says, there is more to do, and we are fully committed to listening, learning, and continuing to take meaningful steps to support a safer environment for everyone. In Winnipeg, Steph Lassou, City News.